I think Pathway can be seen as an accelerator of finding patients, referring patients and getting them into management pathways so much quicker.
The new connectivity between the life sciences, the NHS and tech companies is going to be crucial to facilitate the development of new models of care.
The NHS can't do this on their own. Delivering a programme like this is about partnership.
Our job now with Pathway is to reach into primary care, look for those people with risk factors and check that they're not left behind so that we can say in England we have eliminated hepatitis C. We started in Cheshire and Merseyside in around 2015, and back then we had lots of patients always in treatment, many people who we'll all have heard about for the infected blood inquiry. And our job back then was actually to ration treatment. Treatment was so expensive that we could only treat around 100 people a year. And we've been able to expand our programme to now where we can treat anyone. We've gone to addiction services, to the criminal justice system, the haematology departments, and we've even gone to hostels, all the places that we don't think the NHS gets. We've been there and we've got it. And we think the very final piece of the puzzle to eliminate this disease are people in primary care.
There are some people within there that we wouldn't associate with having risk factors. There's a wide cohort of people with a whole range of risks that we've not really looked at. And using a tool like Pathway to identify those risks within the patient cohort and get them access quickly into curative treatment.
So Pathway has changed our way of working, and we're no longer waiting for GPs to refer into us. We're actively going out, finding those patients in primary care and bringing them to us. The GP still has control of their patients' data, but they can actively share that data with the operational delivery network very safely and very securely. It allows us to actively see what our amount of work is, what patients do we need to support, and that's something we've never had before.
There's over 20 operational delivery networks, and basically it's all predicated around finding patients who have hepatitis C and treating them so they don't go on to get all the major complications that we all fear.
M&C has got a really strong heritage in treating viral disease. The collaboration has come around because we have developed a solution called Patient Search Identification Tool, and we were finding it really difficult to deploy in primary care. So we had some conversations with EMIS on how we could improve that deployment and actually what the real challenges in primary care were, the time, the capacity during COVID.
Primary care is extremely stressed at the moment. What I'm hoping for is how do we utilise it to maximise our resources? How do we work upstream, diagnosing patients where we can effectively intervene, and also downstreaming, so how we can put them into the appropriate treatment or monitoring pathways, and how do we then round that all off for making sure that there's good information flow.
The Pathway solution addresses stigma in the sense that when Pathway searches for risk factors in patient records, you have to do something with it because a list gets generated and that list needs to be validated, and those patients do need to be called in. You can't ignore them. There's a real utility in finding these patients, and between each of those numbers there's a life that has value, so they need to be found and they need to be treated.
So my job is to kind of reach the people that are unapproachable and kind of introduce them to the team at the Royal to say, look, they're not out to hurt you. Because I've been there, I know how they think, I know how they feel, I know how it is. My friend, a really close friend of mine, he had hepatitis C. He didn't get treated in time. When he did get treated, it cleared, but by the time it was too late, basically. It turned to cancer and he died. So when I heard about this job that was coming up, I wanted to go for it because I wanted to find other Johns, you know what I mean, before it got to that stage. I'd had it myself and cleared it on the old treatment. The peace of mind I've got from not having it, it's unbelievable, you know, and I want to give that, I want to offer that to people daily. I think it's essential that we have got that data.
There are patients out there that still need to be found, so we really need GPs, practice nurses, practice managers on board. We need to do this together.
There is no way we would have achieved all of the things that we've achieved so far without working really closely in partnership and collaborating. It's got us to where we are now, and it's what will get us over the line to elimination.
We all understand the challenges. We're all becoming increasingly aware of inequalities and how much of a role they play in health outcomes.
Tools like Pathway show that there is a new way to work with primary care. If we're going to do projects, let's look at different ways of doing it. And I think Pathway is a shining example of that. If we're going to start seeing real changes in population health, this is the approach we're going to have to take. So it's ultimately valuable for us, but its real value is for the patient, because they will get the treatment they deserve.